Hello everyone, my name is Dr. Rishabh Jain, and in this video we'll talk about how to prepare for NEET PG if you're in your third year of MBBS in India. Now just a brief introduction about me. I did my MBBS from All India Institute of Medical Sciences, New Delhi, my MD in Radiology from PGI Chandigarh after securing an All India rank of 4 in AIMS PG and rank 11 in PGI Chandigarh. Now like you, I also started thinking about my PG preparation journey when I was in my third year. And it was only then in my third year that I decided that yes, now I want to be serious about my PG preparation. Now I want to be serious about my MBBS studies. उससे पहले मैं भी बहुत ज़्यादा मस्ती ही मार रहा था. So, if you're in your third year, this is the ideal time to start PG prep. Even if you haven't studied anything in first and second year, don't worry at all. You will still clear PG in your first attempt if you start studying from third year onwards. And in this video, we'll talk about the resources, the plan, how should you plan these third and fourth year of MBBS, coaching notes versus textbooks versus coaching videos versus college lectures, how you should balance each and everything out, and prof versus NEET PG, how to balance the prof studies versus PG preparation studies. Now, third year MBBS is the ideal time to start because third year is the honeymoon period of MBBS. You get the most free in your third year because the third prof only has 4 subjects: forensic, ophtha, ENT, and PSM. 3 are minors and only one subject is major. So 3 minor subjects are very easy to do. So that is why this is the time you can study as well as have fun during your MBBS. Now, before we start doing what to do, let me first tell you what you don't need to do in your third and fourth year. So first of all, don't think that you will cover up first and second year subjects in third and fourth year. No, please don't do that. Please make your third and fourth prof subjects stronger during this time. Okay, majority of the chunk in NEET PG comes from third and fourth year subjects, and even if you do your third and fourth year well, you'll still be able to get some questions from pathology and pharmacology correct. And when you come into internship, when you become post intern, take a 6 months drop or so, it is ample time to cover first and second year in detail regarding PG preparation. If you cover your third and fourth year well during your MBBS, a lot of time will be saved after in your internship and after internship for PG prep. Okay, now second don't read first aid right now. I get a lot of emails and lot of Instagram messages that, sir, I'm in my third year MBBS, how should I use first aid? भाई फर्स्ट एड नहीं है तुम्हारे लिए. फर्स्ट एड का इतना बड़ा फोमो मत बनाओ कि तुम्हें फर्स्ट एड नहीं पढ़ोगे तो पीजी नहीं निकलेगा. फर्स्ट एड एक कंसाइज मटेरियल है फर्स्ट एंड सेकेंड ईयर का, जिसको आप इंटर्नशिप या पोस्ट इंटर्न टाइम में पढ़ सकते हो, थर्ड एंड फोर्थ ईयर में नहीं पढ़नी. थर्ड, डोंट नो यूज ऑफ ग्रैंड टेस्ट इन योर थर्ड एंड फोर्थ ईयर. This is the time to build your concepts of clinics. This is the time to go to the clinics, enjoy seeing patients. That is why you joined medicine, right? Because you wanted to see patients. This is the time you go to the clinics and learn. Don't do GTs right now, no use. Now, fourth, don't. What I commonly see students doing in the library, in their rooms is, if they start studying medicine now, they'll open the videos of medicine first, watch the videos, then read the notes, and then go to the textbooks. Please, please, please don't follow this pattern. Don't follow this pathway that videos to notes to textbooks. No. Please watch videos of only those subjects that you are weak in. And we'll come to that how to integrate videos into your notes and textbooks. Now, for those who are in your third year, your third prof will consist of 4 subjects: FMT, PSM, ENT, Ophtha, out of which 3 are minors and only one is major. So, I would say that keep the prof preparation to 2 or maximum 3 months before your professional exams. उस टाइम में आप आराम से 3 minors और एक PSM कवर कर लोगे. If you are starting your third year now or you started it in January this year, how you should start studying? I'll say that start studying according to your posting schedule. Okay, that is the best way to make a schedule. कि जो clinics आपके चल रहे हैं posting में, exam में, whatever posting you have in your wards, study that material. Okay. Now, for example, you have a 2 weeks rotation in medicine. AIMS has a usually 45-day rotation in medicine, so around 6 weeks rotation होती है हमारी AIMS में. So if you're in your third year and you have your 2 weeks rotation in medicine, try to cover 20% of the medicine syllabus in this 2 weeks rotation. एंड लाइकली इफ यू हैव अ 6 वीक रोटेशन जैसे एम्स में होती है, आई वुड से 50 to 60% ऑफ मेडिसिन के यूनिट्स आप इस पोस्टिंग में खत्म कर लो. नाउ इफ यू आर समवन इन योर 4th ईयर, यू हैव लेस टाइम टू प्रिपरेशन, सॉरी बट अभी आपको ज़्यादा टाइम देना पड़ेगा. आप यही रेशो 2 वीक्स का 30% करिए एंड 6 वीक्स का 90% कवरेज करिए. ट्राई टू फिनिश 90% ऑफ योर सिलेबस इन योर 6 वीक्स ऑफ मेडिसिन पोस्टिंग. Now, this is for all major subjects. So, I'm not just talking about medicine here. I'm also talking about surgery, PSM, gynae. These are 4 big majors. Pediatrics, I consider it between major and minor, more of a minor, because general pediatrics is something that is much more commonly asked both in your profs and NEET PG. Systemic pediatrics आपका medicine से भी हो जाता है. Now, for minor subjects, I'm talking about derma, ENT, ophtha, psyche, ortho, anesthesia, radio. And taking derma as an example, so let's say you have a 2 weeks rotation of derma in 3rd year. Try to cover at least 50% of that thing in your 3rd year only and during your derma posting. And if you're in your 4th year, try to complete the entire derma in your derma posting. Now, when to do PSM? ठीक है, PSM बहुत गंदा सब्जेक्ट लगता है लोगों को, नहीं हो पाता है उनसे. आई वुड से ट्राई टू फिनिश इट ड्यूरिंग योर विलेज पोस्टिंग. दैट इज द बेस्ट टाइम. जब आपकी 7th सेमेस्टर में विलेज पोस्टिंग लगती है, जब भी लगती है, उस टाइम पे 1-1.5 महीना होता है, अच्छे से आप पूरा PHC का सिस्टम समझते हो, कैसे PHC फंक्शन करती है, CHC सब सेंटर्स कैसे फंक्शन करते हैं, हेल्थ प्रोग्राम्स कैसे रन करते हैं. दैट इज द बेस्ट टाइम टू फिनिश PSM. नाउ ये तो मैंने बता दिया कि कितने टाइम में पढ़ना है. What to read, what are the resources that you should read during these 2 weeks of medicine rotation. Now for that, I would say that make your notes, coaching notes as your baseline. So now I am sure a lot of students have pre-printed coaching notes available with them. Make them the base of your knowledge and add extra thing from textbooks. So let's say I am starting my medicine posting today. I have decided that yes, I'll start with rheumatology. Easy topic, easy unit to start with in medicine. What I'll do is I'll open the notes of my coaching of rheumatology, have a read of the notes only at this time, then open a textbook of medicine. What is the textbook? I'll again tell you in the video in the below sections. So I'll open the notes, have a quick read, then I'll open the textbook, have a good read from the textbook and add the extra points in the main notes itself. Now, make sure, just hear me out, that the notes that I'm talking about are not revision notes now. These are the main coaching notes that you have with you. Now, which coaching notes to buy? I would say any app would do at this point of time, because your main concept, your idea here is to build concepts now. So even if, let's say, you buy the cheapest notes that are available in the market, that would do, because your resources for revision during internship and post-internship will be very different. Okay, tab you'll read revision notes and you'll join a test and discussion. तब की planning अलग है. अभी के लिए you can read your main notes, you should read your main notes, add them, supplement them with your textbooks. Okay, so for all 10 subjects at least, you'll have coaching notes annotated with your textbooks. Now, when to watch videos? Only watch videos for those topics which you do not understand either from your textbook or your notes. Okay, any app would do for your videos. Preferably choose an app which has less number of hours. For example, if you're reading medicine, there is no point of watching 250 hours of medicine lectures. Try to see an app which has around 80 to 120 hours of medicine lectures in it, right? Now, example I'm taking, you have a medicine posting in your 3rd year. एम्स में इट इज़ फॉर 6 weeks. एम्स में 6 हफ्ते की होती है मेडिसिन पोस्टिंग. सो मैंने टारगेट क्या बनाया कि मुझे 50 to 60% अपनी मेडिसिन खत्म करनी है ड्यूरिंग दिस टाइम. ठीक है, तो मैं हाउ विल आई स्टार्ट रीडिंग मेडिसिन? आई विल से कि ड्यूरिंग दिस 6 weeks I'll read these following units. So I'll try to cover rheumat, respi, nephro, endo, GIT and hemat. Even if GIT hemat thoda nahi ho paya, at least these 4 units I'll try to definitely finish during my this posting only. What to read in these 4 units? I'll open my coaching notes, have a good read from the notes, one reading, then I'll open the textbook, read the same thing from the textbook and annotate it back into my notes. I'll only watch videos of those units or topics which I haven't understood from my main notes or textbooks. Now, along with this, since you're doing this whole schedule along your medicine rotation, medicine posting, you should definitely read your bedside clinics textbook. That is either you're reading Kundu or Hutchinson or Algappan, whatever suits you. I personally like Kundu very much for medicine. I read Kundu, it is very good. You can try it. So for major subjects, this is the broad plan. Okay, try to complete 50 to 60% of that subject in this 6 weeks of medicine rotation. Now for short subject, for example, derma posting, ENT posting, ophtha posting, try to finish at least more than 70% of that subject in the same posting. This is for minor subject. Now, which textbook to read? I told you notes plus textbooks plus minus videos. So which textbook we are talking about? So for medicine, okay, I think a lot of students have this doubt ki which textbook to read for medicine, Davidson, Harrison, which is the textbook. So I personally read Harrison, very nicely written book. The advantage of reading Harrison is that it is evidence based and it gives you guidelines. You can quote those guidelines. Those guidelines are directly asked in the exams. Your question won't get wrong. The problem with Davidson is that it does not give you exact guidelines and algorithms and something that you can directly quote. So I think that way Harrison was very good. I also could not complete the entire Harrison. Nobody can finish the entire Harrison, believe me. What you need to know is read important topics from Harrison. So, for example, when my medicine posting was going on, I tried to finish cardiology from Harrison, very nicely given. But obviously, you can't retain Harrison, right? You can't retain Harrison. That's why I'm telling you the combination of notes plus textbook. Okay, notes plus textbook is a very good combination. You will be able to retain some of it in the form of notes if you have it. Textbook से नहीं हो पाता है retain. Now, if you're someone who thinks कि नहीं हो पाएगी Harrison, and a lot of people would resonate with me. Some people would say कि सर आप Harrison क्यों नहीं बोल रहे हो, alternative क्यों ही बता रहे हो? See, Harrison नहीं हो पाती है सबसे, and it is okay to not be able to complete Harrison. Another textbook that I will recommend, highly recommend in fact, is CMDT. Okay, CMDT. CMDT is current medical diagnostics and treatment. So it comes in every year. So every year new CMDT comes in and it gives you the latest guidelines and management algorithm for diseases. So for example, you're talking about diabetes mellitus. I read diabetes from CMDT, beautifully given. So it will tell you target blood glucose, blood sugar, BP monitoring for that age group and evidence-based guidelines for all management of diseases. Very concise form, tabulated form, flowcharts which you can easily copy in your professional exams also. So CMDT is less bulkier than Harrison. Harrison is a very bulky disease with very thin pages, very small font, and hence it is very difficult to retain. So CMDT is a very good book. You can refer if you're not able to read Harrison, but main notes would also suffice. Now, whenever you are reading Harrison, and if you decide to read Harrison, don't start with introduction, epidemiology, pathophysiology. No, start with directly clinical features and management. If you start reading from intro, you'll never be able to complete that chapter, and आपकी Harrison खाली रह जाएगी. So start with clinical features and management. Now ECG का बहुत लोगों को question होता है कि sir where to read ECG from? Now this is a very gem of a book that I'm telling you. The only EKG book you'll ever need. This is a very nicely, beautifully written book. The only EKG book you'll ever need by Malcolm Thaler. I read this in 2 days only, completed it, and at the end of this book, you'll get you'll get few summary points. The whole ECG, all the diseases, narrowed down to 6 pages only. I'll put the link down my description that how I annotated my ECG notes from this books, very nicely written. I'm sure if you check them out, you'll really like them. So this, the only EKG book you'll ever need. Highly recommend you to read this textbook. Available free of cost online, PDF you can download from LibGen, etc. No need to buy it. You can read the PDF only. Now for surgery, Bailey in Love is a very good textbook. Okay, if you read it along with your notes, it will really make sense. But I'll tell you another very gem of a book, that is Washington Manual of Surgery. Okay, so this is how Washington Manual of Surgery looks like. Currently it has in its 8th or 9th edition, I'm not sure. But Washington Manual of Surgery gives you evidence-based guidelines. So these are guidelines which are followed in the US in St. Louis, Washington Hospital, St. Louis Hospital. And for example, it will give you acute cholecystitis management guidelines. It will give you peripheral artery disease management guidelines, the task classification. So it does not tell any bullshit. कोई कहानी कोई story नहीं बनाती. It tells you guidelines based management. So I'll highly recommend that you at least read breast, trauma, and peripheral artery disease from this Washington Manual of Surgery. Very, very nicely written. Now, Manipal Manual of Surgery, SRB Manual of Surgery, I haven't personally read. Again, they had a problem that they don't give guidelines based answers. So, I did not read them. I read Bailey and Love and Washington Manual of Surgery. Very nice combination. Now, for Peds, don't read anything else apart from Ghai. Ghai is a complete textbook of pediatrics. Just add some NICU protocols that are followed in AIMS because they are asked in INI-CT. Now, you can get these NICU protocols directly from the AIMS NICU website. They're freely available for everybody. Now, gynae is a very, very important subject as far as your PG entrances are concerned. Now, OBS, you either follow DC Datta. At AIMS, we have a culture of following JB Sharma textbook of obstetrics. Again, Dr. JB Sharma is a professor at AIMS. Very nicely written book, easy to understand, flow charts ki format is given. So what I did that for all the flow charts in OBS and Gynae, I just annotated those flow charts and summarized the whole chapter in that flow chart. So at the end, when I wanted to revise for the exams, I just flipped through the flow charts and the whole OBS was, revised in 4-5 hours only. For gynecology, there is a dearth of good textbooks. So Shaw's textbook that is, recommended world over for gynecology for MBBS students, it is not a very good book of gynecology. Again, it lacks that evidence-based guidelines in gynecology. So I'd again recommend you to read this Johns Hopkins Manual of Obs and Gynae. So this is how this Johns Hopkins Manual of Obs and Gynae looks like. Read Gynae from here, especially cervical cancer. Cervical cancer, uterine prolapse, and I would also say that read AUB also from here. But cervical cancer is a must. ठीक है, very nicely written, evidence based guidelines given here, flowchart form में दे रखी हैं, कोई confusion नहीं होगा. Now let's come to other minor subjects now. So PSM is not a minor subject, sorry, but PSM में nothing else to read apart from parks. Sometimes parks में difficult to get some grasp some important रट्टा नहीं हो पाता है पार्क से. कभी कभी बहुत ज़्यादा कहानी बना रही होती है पार्क्स में. फॉर दैट यू कैन रेफर टू डॉक्टर विवेक जैन्स टेक्स्ट बुक रिव्यू बुक ऑफ PSM. बट अगेन पार्क्स इज अ स्टैंडर्ड टेक्स्ट बुक. डायरेक्टली क्वेश्चंस कम फ्रॉम हेयर बोथ इन प्रॉफ एंड नीट PG. नाउ जो आपके हेल्थ प्रोग्राम्स हैं, हेल्थ प्रोग्राम्स प्लीज एंड प्लीज बस पार्क से ही पढ़ना. ठीक है, हेल्थ प्रोग्राम्स पार्क्स में सफिशिएंट दे रखे हैं, एम्पल दे रखे हैं, उन्हीं से क्वेश्चन आएगा. ठीक है, और कोई नई टेक्स्ट बुक पढ़ने की जरूरत नहीं है हेल्थ प्रोग्राम्स के लिए. जब PG प्रिपरेशन के लिए इंटर्नशिप में जाएंगे तब एक्स्ट्रा पॉइंट्स ऐड कर लेंगे हम अपने रिविजन नोट्स में. नाउ फॉर साइकैट्री, the most commonly textbook followed all over India is Neeraj Ahuja, but unfortunately Neeraj Ahuja is a shit textbook. Sorry for using that word, but it is really a shit textbook of psychiatry. I would say that read Oxford Manual of Psychiatry, but it is a handbook. Sorry, it is a handbook of psychiatry, but it is a little bulky. So अगर आपको ज़्यादा नहीं पढ़ना है, then Dr. Praveen Tripathi's review textbook of psychiatry is very good. You can read that. Now orthopedics, again Dr. Maheshwari's textbook of orthopedics is very nicely written. Dermatology, please don't read anything else apart from Dr. Neena Khanna's textbook. PG में directly images come from Dr. Neena Khanna's textbook of dermatology. ENT Dhingra, very nicely written book. Don't read anything else apart from it. Ophtha, Ophtha, I also struggled in Ophtha. I can't really recommend you any textbook in ophthalmology because there is a dearth of good textbook in ophthalmology, frankly, for MBBS student. I tried reading Khurana, could not learn it in the first go. A hard textbook at MBBS level, I would frankly say. I've heard Dr. Ruchi Rai's textbook is easy to read, has simplified concepts. You can try it. Again, Dr. Utsav Bansal's review of ophthalmology is also good. You can try it. Khurana is a little tough textbook to grasp at MBBS level. I can agree to that. Now for anesthesia, I'll tell you a very nice textbook of anesthesia, that is Primer of Anesthesia by Dr. Rajeshwari. Now Dr. Rajeshwari is an ex-HOD of anesthesia at AIMS, and she has written this textbook, and very nicely written Primer of Anesthesia, a thin textbook. You can easily flip through it during your anesthesia posting, and easy to understand. Directly questions come from it. Now for forensic medicine, forensic medicine, most people follow Parekh, but it is again a big bulky book for forensic medicine. What I read for my forensic exam was Dr. R.K. Sharma's concise textbooks of forensic medicine and toxicology. Again, Dr. R.K. Sharma is a faculty at AIMS Delhi, and he has written a thin book of FMT which I could read in 3-4 days and completely vomit out in my prof exams. Now for PG entrances, FMT, if you want to read, again your coaching notes, revision notes would suffice for FMT. Don't go back to textbooks back then. Now this was about textbooks. So what formula did we make? For any subject that we'll read during our posting, we'll read the notes, supplement it with textbook plus minus videos. Okay? This is the basic outline for all our subjects. How will we plan our subjects? We'll plan according to the posting schedule. Okay? I think this is clear. Now, what about class lectures? See, class lectures are very randomly arranged during your MBBS course. So it is difficult to follow them. It is difficult to make a schedule out of your class lectures. I would say that stick to your posting schedule. जो पोस्टिंग चलती जा रही है उसके अपनी नोट्स प्लस टेक्स्ट बुक्स प्लस माइनस वीडियोस देख के चलते रहो. नाउ लेक्चर्स में अटेंडेंस यस मैंडेटरी है. ट्राई टू कवर दिस 75% अटेंडेंस यस. एंड एनी गुड लेक्चर अगर आपको मिलता है ना क्लास में, भाई उसके नोट्स बना लो. मुझे अभी भी याद है कि अपर जीआई ब्लीड की क्लास ली थी डॉक्टर प्रमोद गर्ग ने एम्स में, एंड इट वाज सच अ ब्यूटीफुल क्लास ऑफ अपर जीआई ब्लीड. आई मेड नोट्स ऑफ दैट क्लास एंड यूज्ड देम इन माय पीजी प्रिपरेशन आल्सो. सो अगर कोई अच्छी क्लास है आपकी lectures में, please make notes and use those notes. So to summarize, we'll read notes of any subject during our posting, supplement it with textbook, plus minus watch videos. Now, I'm sure you will not be able to complete all the modules of all the subjects. Nobody can. It is humanly impossible to do that. Our target right now is to cover 60 to 70% of the 70% of the whole module that is given to us. And third year में of this whole 60 to 70%, try to cover at least 50% of this. Even if 40 to 50% चलता है, next year हम cover कर लेंगे. So this is my whole summary of how you should go about your PG preparation in your third year. If you want to join an offline coaching, yes, you can join an offline coaching too. If that helps you make a schedule, helps you make a note. If you're that kind of a person that कि किसको पुश चाहिए कि भाई मैं कोचिंग में 10 घंटे बैठ जाऊं तो नोट्स बन ही जाएंगे, भाई पक्का ज्वाइन कर लो कोचिंग. इफ यू आर अ सेल्फ पेस लर्नर कि अपने पेस से मैं आराम से डेली थोड़ा थोड़ा पढ़ते रहूंगा, देन टेक एन ऑनलाइन ऐप सब्सक्रिप्शन, वर्क्स इक्वली वेल. ठीक है, पोस्टिंग के हिसाब से पढ़ो. ट्राई टू रीड 40 to 50% of that subject during your one posting in your third year only. So with that, I'll end this lecture. In the next lecture, in the next video, I'll talk about fourth year MBBS, how you should go about preparing for your profs and for your NEET PG. Till then, thank you.